Have you ever considered how closely the mind and body are intertwined, especially when it comes to depression and erectile dysfunction? It's a curious link that scientists and medical professionals have been exploring for years. Let's dive into the depths of this topic and see what the experts have to say. Edward Lauman, PhD, a professor of sociology at the University of Chicago and lead author of a major survey of sexual dysfunction, once said, "The mind is a very important part of sexual arousal, and if a man is depressed, he may not find himself as sexually attractive." Depression, a mental health condition that affects millions across the globe, can have a profound impact on a person's sexual health. Now move to erectile dysfunction, a condition where a man is unable to maintain an erection for sexual intercourse. It's not just a physical condition, it's also deeply connected to the psychological state. Dr. Abraham Morgentaler, a clinical professor of urology at Harvard Medical School, says, erectile dysfunction can be the first sign of depression in young men. That's because depression can lead to feelings of worthlessness and a lack of desire, which can result in erectile dysfunction. So the connection between these two conditions is not merely coincidental. It's a complex interplay of mental and physical health, where one can significantly affect the other. Studies have shown that about 1/3 of men with major depressive disorder experience erectile dysfunction. On the flip side, men with erectile dysfunction are more likely to be depressed. It's a vicious cycle that can be hard to break without proper treatment. Renowned psychologist and sex therapist Dr. David Schnarch points out, depression and erectile dysfunction can feed off each other. It can be a vicious cycle, but it can be broken with proper treatment. What is this proper treatment, you ask? It's a combination of psychological therapy, lifestyle changes, and sometimes medication. But the first step is always acknowledging the problem and seeking help. So we've seen that depression and erectile dysfunction are more closely connected than one might think. They're not just isolated conditions. They're two sides of the same coin. One can lead to the other, and vice versa, creating a cycle that can be hard to break. But with understanding and treatment, this cycle can be broken. As Dr. Schnarch says, it's not a life sentence. With the right help and support, men can overcome both depression and erectile dysfunction. To sum it up, depression and erectile dysfunction are closely interlinked conditions. Depression can lead to erectile dysfunction, and erectile dysfunction can lead to depression. But with the right treatment and support, this cycle can be broken. Remember, mental and physical health are intertwined. It's important to take care of both. And if you or someone you know is struggling with these conditions, don't hesitate to seek help. Thank you for joining this exploration of the complex relationship between depression and erectile dysfunction. It's a topic that needs more understanding and conversation for the sake of millions of men around the world.